This is the Physical Activity Researcher Podcast, a podcast for researchers of sedentary behavior, physical activity, and sports. Join for a relaxed dialogue about research design, practicalities, and, well, anything related to research. Learn from your fellow researchers useful and relevant information that does not fit into formal content and limited space of scientific publications. And here is your host, researcher and entrepreneur, Olli Tikkanen.
Welcome, everyone. Before introducing guest of today's episode, I would like to note just a few things. Physical Activity Researcher podcast is committed to promoting equality and diversity in all its activities, including selection of guests. We have limited resources to scout all great researchers from different groups of people, so if you know someone who should be as a guest in the podcast, please ask this individual to contact us directly. As another thing, I would like to ask for your help. Being able to deliver this podcast to you, my audience, is based on how many people find, start to listen, and follow this podcast. So I would really appreciate little help promoting this podcast. You can do this by subscribing, following the podcast on Twitter, retweeting tweets sometimes, and maybe even giving a good rating if you liked an episode. And now it is time for the actual show and introduction of our great guest of today's episode. She holds a bachelor degree in psychology from Universidad Mayor de San Andres in Bolivia and master's degree in applied and affective psychology from University of Geneva. Currently, she is PhD student in psychology and behaviour change in University of Grenoble-Alpes. Her research examines psychological and contextual factors that determine commuting behaviour. Ladies and gentlemen, please welcome our guest, Claudia Teran. Welcome, Claudia.
Hello, Olli. Thank you very much for having me here with you.
No, it's nice that you can take the time. So you are in France and you have had quite a long lockdown. How is life now in France?
So we have been locked down like 2 months, but at the same time, at least it was interesting because even if we couldn't go outside and do our lives, we could go outside for doing physical activity. So I think that was something really interesting that French government decided that a really good excuse, or we will say, or a really good reason to go out was for doing physical activity. But it was just like 1 kilometer around our homes and just for 1 hour per day. But at least we could go out and run or take a walk.
Yeah, it has really highlighted the importance of physical activity that has been the only reason almost that you're allowed to go out. And I understood that you have been doing some data collection about physical activity during the pandemic. So could you tell more about this project?
Yeah, so we were trying to see if there were any limitations or any barriers, or at the same time, any levers to people doing physical activity now during coronavirus. And we are now analyzing our results. And it was interesting to, for example, see we had at least 400 people answering our questions. And for example, the people with more children, they had less time for doing physical activity, or the people living in smaller apartments, because in France there's some people that live in 9 meter in just 9 square meters or little apartments. These people was the people that was not doing physical activity. So it was interesting to see also the contextual limits and barriers to doing physical activity during coronavirus.
So did I understood right that the people who are living in the small apartment were not doing physical activity outside?
Well, yes. So they were doing in general less physical activity than people living in bigger places.
Yeah. And do you think the difference is just that people in a higher socio-economic situation usually do more, because you could think that people who are in a very small apartment, that they would really like to go out, and if the physical activity is the only reason that you can go out, they would do that. What do you think is the reason?
I think there are many reasons that we are now trying to research a little bit more. Like, for example, in general, people living in these kind of apartments live in dangerous neighborhoods where you don't really want to go outside for running. It's not like a good idea. But at the same time, it could be possible that this is the same people that have a lot of children, so they can't take some time for them because they are taking care of their children. So it is, I think, really important to consider each reality and understand that we have like motivational barriers because maybe we don't want to do physical activity, but we can have like real physical or environmental limits to our physical activity.
Yeah, that makes all the sense. So did you collect the data only from your region or the whole France, or how was the region?
We try to have a French population, so we send the questions everywhere. Clearly, it was easier to have information from this region, but we can compare the information with people living in Paris or in Grand Est, which was one of the most affected zones of coronavirus.
Mm. And probably you made the study design quite quickly when this all started, without any notice in a way. How was the practicalities? How did you came up with the questionnaire? How did you distribute it? And how did you manage the whole process to collect the data really fast?
So already we could. I had a lot of support of my laboratory because it was a project shared between 6, 7 people, and we need to work really fast because we didn't know at the beginning how long was going to be the lockdown. And it was a good time because it's obvious it's a hard time, but it's at the same time an extraordinary time for understand people's behavior. So we worked really quickly, like choosing the questionnaires and also knowing the limits because obviously we couldn't give the people accelerometers or any objective measure of physical activity. Everything is self-reported. And so we worked together, we choose the questions, and we did the questions online, and we tried to send it to all of our colleagues working around in France. And we have a great response. I think that it's really nice to have more than 400 people that answer our questions, but it was really fast and we needed to hurry up.
Yeah, I can really see the difficulty in there. So you said that you send it to your colleagues, and how did the colleagues then distribute it, that you actually got people in different socioeconomic situations? How did you manage to do that?
We use a lot our social networks like Facebook, Twitter, and it worked because we have many friends of friends sharing it in different places in France, send them to their families or their friends living in other different regions. And it was mostly did it by using social networks.
Yeah, that's very good. And you were also asking about stress and well-being. Have you already looked at the results? I think it's very interesting. Like, you had 2 months lockdown, so how was the well-being with people?
So this is the second study. So we were interested in, to see where if there were any effects of people doing physical activity and how this could affect maybe improve people well-beings. I couldn't really start explore. I didn't explore yet the data because I'm working on the other study. So when I will have the results, I will be really happy to share it with you and with everyone.
Yeah, that will be interesting. So do you have same participants filling the both questionnaires, the physical activity ones and the stress and well-being, or do you have different participants?
We have different participants. So we have 400 for the first study about physical activity and barriers and motivational levels of physical activity. And for the second one, we have around 300 people. These are not the same people.
Hmm. And do you plan to collect data from the same participant now after the lockdowns have or the restrictions have been relieved, or was it just like one time point that you plan to have?
So we have been collecting data each week for some participants for the first study about physical activity. So some people agreed to be contacted once per week, and the idea was that each week after week we will compare how the physical activity evolves. And the same idea, we will ask again them to answer our question after after the lockdown, and 1 month after the lockdown, the end of the lockdown. It's the same for the other study. We will ask them again the questions like next week and in 2 months.
Hmm. Yeah. Yeah, I think it's very good project. I think I have seen some messages in Twitter and different channels that, for example, they are doing similar things in UK and in Finland, probably collecting little bit different data. And I think there's one organized which is a little bit more international, that they try to collect data. Um, would you like to collaborate with different countries if they are in the pandemic a little bit later, that they are doing lockdown? Are you interested to do the same questionnaires in different countries?
Yes, of course. It would be really interesting to compare because already for cultural reasons, I think that each country is different. Political reasons, the same. Not all the lockdowns were the same. Not all the lockdowns, like for example, in France, we were supposed to be at home. We could go outside for doing physical activity. So it would be interesting to collaborate with other researchers and to understand that it might be different reasons for doing physical activity in France or in other countries.
Yeah, so if anyone's listening and your country is going into lockdown a bit later, you can be in contact with Claudia, and you can see if you could collaborate. I think in France the lockdown has been one of the most intensive. And how was it for you personally to stay 2 months mainly at home?
So at least I'm a little bit lucky because I have an apartment, but I have a garden, a shared garden that I share with other apartments. So I could at least go there. But it's been hard because it's clear that it's not the same not to go out and enjoy, because it was really sunny and really nice this last month. And I think that it has been hard for me. I can't imagine for people living in small places without sun, without any green places around. And at the same time, it was yeah. I think it was stressful and it was hard, but at least I kept my way. I work a lot. I think that helped me the most. That working on these two projects helped me a lot for being for feeling myself useful and feeling myself that I was doing something.
Yeah, I can really believe that it has been challenging for people in a small apartments and in different conditions.
This podcast is sponsored by Fibion, a research device that has been shown to be valid in tracking sitting, standing, physical activity and energy expenditure. Furthermore, Fibion has been shown to be valid categorizing physical activity into light, moderate and vigorous intensity. In addition to scientific accuracy, Fibion provides automatically produced and easy-to-understand reports for research participants. Get scientific validation and learn more about Fibion at fibion.com/research.
So if we move to another topic, your PhD study, which is about sustainable mobility, could you tell more about that project?
Yeah. So I'm doing my PhD in a collaboration with other laboratories. So one part of my PhD will include all the psychological part, and the other part will be the geographic. I'm not a geographer. I'm a psychologist, but I'm learning a lot about geography. And the idea is to understand which are the barriers and which are the levers to mobility change. We would like to promote sustainable mobility using the bike, walking, or using public transport. And we would like to help the people that are used to use their car all the time to change their mobility. But at the same time, we would like to understand why these people has some problems, could have problems to change mobility. If it's just motivational, or maybe if there exist any real objective constraints to changing mobility.
Mm. And what kind of obstacles you have found? What are the main obstacles being using active or sustainable commute?
So already, what we need to understand that we have a really strong part of urban environments. Like maybe in your city or where you live, you don't have transportation that is safe or accessible. You don't have bicycle lanes, so you have concrete and objective constraints to your mobility. Or maybe your neighborhood is not walkable, or maybe the topography of the ville makes complicated to take your bike. You have economical factors, like use the car has a price, you need to pay for fuel, the same for using the train or using the public transport. And at the end, you have personal factors. So we have the motivation, the habits, the knowledge, the attitudes, or even the self-efficacy. But we also have family commitments. If, for example, you are a mom and you have 3 children, and your 3 children have their school really far, the one from another, it will be easier to take your car to take each one of your children. Or at the same time, if you live really, really far from your work because your husband needed to work near from your house, you will prefer to take your car to go to your work. Also, if you do a lot of trip trainings, like for example, you start going to your work and then you go to do your shopping, and then you need to go and search take your child, and then you need to go to other place. So more trajects you need to do, more you need to change of places. It will be easier to take your car.
So quite many obstacles ranging from personal factors to different infrastructure things. It sounds challenging. There's a lot of obstacles. How do you think you will succeed in this kind of task?
So what we have plans is to do a randomized control trial. And we have 2 groups. A first one that will have a normal, let's say, intervention, talking about the air pollution, the consequences of using car all the time for the environment or for the health. So they will discuss about that. And for the other group, we are proposing free access to transport or to bikes. So during 6 months, this group will have completely access to bikes or to public transport in the city in Grenoble. And at the same time, we will help the motivational part. We will help these people planifying how, when, and how they are going to change their mobility. We are going to try to have concrete objectives for these people, and they are going to planify. They are going to try to start their process of changing. So at this level, we will see if this already works. We're using this randomized control trial, and we will see if there were any other constraints that didn't allow these people to change. Like I mentioned before, maybe they live really far from their work, so they have too many children. So we could measure also if there are any objective constraints around their change.
And what is the stage of the study now, where you are at this in this randomized control trial?
So we have a little bit of delay because of the situation, but we are starting our pilot study because already we will use a lot of equipment for these studies. Like for example, the people will carry air pollution detectors and accelerometers. That's how we are going to measure their physical activity during transport and their pollution exposition during their transport. So we needed to buy that. We need to understand if it's possible for people to carry all of this equipment, and that's why we are doing our pilot next October. It will take 3 months. We are doing a 3 months pilot study, And the idea is to start the whole project in next January and follow the people during 2 years.
Yeah, so they will actually wear accelerometers and air pollution meters. How is the air pollution meter? I haven't seen it. So what kind of device? How big is it, and how expensive those are?
So it's called air pollution capture. It's like a little box. I can tell like 20 centimeters and 2020, like a little box. The problem is that you have something going out from it. I don't know how to say it in English. Like, sorry for this, but
Yeah, no problem at all.
like a bulb.
All right. Yeah.
Like no, it's not the word. A straw. So
Yeah.
you have a straw going out from this equipment, and the idea is that the straw, it will capture all the pollution, all the dust around you every minute, and we will know that at 10 a.m. you were around, you had around this quantity of pollution around you. So
Yeah.
the problem is that you need to take care of the straw, because if your hair goes inside, it will not help. And you need to carry this all day long. So if you go to different places, you need to have it into a bag or something.
Yeah. Yeah, sounds like a interesting approach to actually have the air pollution meters. And do you plan to give feedback to people about this data, that they would actually kind of be encouraged to be less in the polluted environment? So how do you plan to use the data?
So we will use it first for seeing if people using public transport or biking, they are less exposed to air pollution. And the idea is to give them, it's really long to analyze this data. So we will promise them to give them feedback, but it will take 1 year or two more. But the idea is to give them, maybe that will be a good reason for staying in our study, because they know if they stay, they will receive, because they will have a report about how exposed they are to air pollution.
Mm. And how is the pollution in that area of France? What kind of results you get in normal days of pollution?
So it's a quite polluted city. It's not as polluted as Paris, but it's the World Health Organization recommends just 10 micrograms of air pollution exposition, and we are in 16 here, so we are a little bit high, so we are exposed to more pollution than we are supposed to be. So the pollution is important here in Grenoble, and one of the main reasons is the topography of Grenoble, but because we live like in a we are around, we have mountains around, so sometimes the pollution gets just stuck and it doesn't move like in other cities. So we are quite exposed to air pollution here in Grenoble.
Yeah, I'm now living in Finland, and actually at the moment I'm almost middle of forest, so we don't have that problem. But I have been living in Beijing and Shanghai, and especially Beijing because it has the mountains around, so it gets really bad. I think it's probably at least 10 times more than Paris many times, but yeah, there it is quite horrible. And you said that they are wearing an accelerometer. Which kind of accelerometer you plan to use?
We will use a SenseDoc. It's a Canadian accelerometer, because it allows us to have GPS data and accelerometer at the same time. So they don't need to use the different equipments. They just need to use a SenseDoc. And it was because at the same time we need GPS data for understanding their mobility. It was a good idea to take just one tool for measuring both accelerometry and at the same time GPS.
Yeah, I think in your case the GPS is important, and I'm not familiar with this device, is it wrist worn, or where do you actually wear it?
No, it's like no. You need to put it around you. You can put it everywhere. You imagine it's just to use it around the waist.
Yeah. So is it collecting raw accelerometer data, or what kind of thing it's recording?
Sorry, broad.
So is it measuring raw acceleration, or what kind of data is it recording in the memory? Do you know?
Not. I'm not really sure. Just it's a triaxial accelerometer. So
Hmm.
I know it measures three not dimensions but axes.
Yeah. Yeah. All right. That's good. And and then in the study you are also looking, like we were looking the obstacles, but you are also looking the levers for sustainable mobility. What kind of levers there are for this?
We were thinking already about motivation. But for example, if you really like and enjoy doing a bike, it's really possible that if you need to change of mobility, you will choose bike because you already have this pleasure of taking your bike. So like self-determination theory of physical activity. We can see maybe self-efficacy because, for example, at the same time, it could be a lever or it can be a problem. For example, myself, it has been 15 years that I don't use a bike. So it will not be the first mode of transport that I will choose. I will need to train myself before going to the city in bike. But I think that there is people that have a lot of self-efficacy. They need how to use a bike and they could do it easily, and maybe they didn't think about before. But it could be our intervention could be a nice opportunity for people to adopt a bicycle, for example, for going to their works or to other places.
Mm. And how is the geography of the region? You are quite close to the mountains. How much there is hills in the city?
We are lucky because it's a flat city. Even if we have a lot of mountains around, it's a flat city. It's one of the flattest cities in France. And that's why a lot of people say that it is a really bikeable city because already we have a lot of bicycle lanes. And because it's flat, we don't really need to do a lot of effort for taking our bike and biking wherever.
Mm. And you probably know the Copenhagen study, where they have been following bike use and public transport use for, I think, 3 decades. So how do you see the Copenhagen comparing to your region?
I I'm not really familiarized with these studies. So
Yeah.
yeah,
Yeah, I think the Copenhagen study, I haven't read it too well either, but I think it's just that I think the main point that if you just build the infrastructure for biking and for public transport, that you you create possibilities, people will start to use it. I think it's been shown that during 3 decades the bike use has been increasing steadily, and it's in a really high level now. That it's just, I think the main point is that when people have the possibility to use bike, in a long run they will actually start also to use it.
okay. I have some opinions about this because it's the same when we talk that some cities have free transport. Yeah, there are some cities here in France that have free transport, so you can take it whenever you want. But that doesn't really mean that everyone and car users will take new transports. So you can change the environment. You can make more accessible transport, but that doesn't mean necessarily that everyone and most probably car user will take these new modes. And that's what we have seen in a study here in France, that the people that started using this free transport was the old bikers. So car users were still taking their cars, and the people trying to take new modes of transport were the same that were trying other transports than car.
Mm. And how do you expect the results to be that you are providing free public transport? Probably for people who are well off, probably for them it doesn't make a big incentive because they probably have anyway enough money to use the public transport. But for people with less money, it might be make a difference. How do you see this aspect?
I think, yeah, it's completely right that for people not having the resources, it will be amazing to have now access to public transport or to bike. But at the same time, that this free transport, this free bike might help this economic factor. It might help to change habits because now that you have your free transport, maybe you never have it tried before, and now you have free access. So you will try and you will say, "Oh, it's not that bad," or you will take a bag and you will try it, and because you're trying, because you're changing your habits, because you're changing your context, so you will have more tendency to try this new method that someone else is offering you.
Yeah, I agree. That makes sense. Actually, my colleague, his name is Arto Pesola. He's doing a project now. There's one city in Finland where they give a free public transport for young people, and then there was quite a bit of discussion that will it actually decrease the physical activity of the young people because now they don't need to walk or cycle, that they can use the public transport. And the other people were saying that now they can actually go to all the hobbies because they have possibilities that otherwise the parents would have been needed to take them to those hobbies, and now they are comparing two different cities, and it's somehow quite similar setup that they are having accelerometers and GPS, so you might find some interesting things with Arto. I can give his email to you, so it's quite similar study setup in a way.
Oh, yes, it will be really interesting because I was not aware of this study, but of course it will be interesting to see how it changes. I've even follow them year when they will have access to car, if they will choose to keep public transport or to go and take their cars.
Hmm. Yeah.
This podcast is sponsored by Fibion. Fibion is an accurate sitting and physical activity tracking device and analysis platform. It is a great tool for projects that aim for behaviour change in sedentary behaviour and incidental physical activity. Fibion provides easy-to-understand PDF and web browser reports for participants. Other features include comparisons to recommendations, linking results to health risks, achievement cards, and interactive goal-setting tool. In addition, Fibion provides an API that allows for easy integration to other systems and applications. Learn more about Fibion at fibion.com/research. Fibion, from researchers to researchers.
And how is it working? You said that you have really interdisciplinary team. How is it working with people from totally different fields of science? How does it work?
So just for giving you an idea, we come from like at least 10 labs. We have like biologists, we have epidemiologists, geographers, sociologists, economists, psychologists, and we have a lot of different fields from different sciences, and mainly from different approaches. Because already I'm working, one of my thesis director is a geographer, and already understanding which methods they use to collect data that they didn't resemble to the methods in psychology is really challenging, because you need to be really open mind to work with different people from different fields, and at the same time you need to understand what they are using, why they use these methods, and maybe you don't agree, you say that it can do the things more complicated for analyzing it. But I think it's challenging, but at the same time it's really really interesting, because you learn a lot of things, and sometimes you say, oh yeah, we should do that in psychology, it would be interesting to have these approaches, or we would need to understand the behavior like this and not just like this. So at the same time, it's challenging, but it's really, really interesting.
Yeah, I think it's quite rare to have such a interdisciplinary team. How did this project get started that it became what it is now?
So it was born 4 or 5 years ago. It was the idea of an economist and an epidemiologist, and they started this consortium, and they start calling other people because the principal idea of the whole project is to reduce air pollution. So they were aware of the high levels of pollution here in Grenoble, and they said which are the principal sources of pollution. Of course, transport and heating. That is the second important aspect of the research. And they start calling other people that could work in the same project, and that's how they found like people from chemistry, people from physics, and from psychology to better understand how we can change, how we can reduce air pollution from different teams, from different approaches, starting from the behavioral part, finishing with the political part, how we can advise new politics, new policies for reducing air pollution.
Hmm. And probably the local government is quite involved. How are they involved, and when did they came along with the project?
Yeah, they are pretty happy to work with us. But like I said, it was born in the university from the labs. Then we went to propose to collaborate with the local government, and they, for example, they accepted to pay all the free transportation and the free access to bikes to our participants. So it's the government, the local government, that will pay this. And at the same time, we have a lot of meetings with them. We discuss which are their approaches or their points of view of what we are doing. So they are quite involved working with us. They are part of the team, and we have each 3 months we have meetings with them.
Hmm. Yeah, it sounds like really nice project. How do you expect? Do you think you can actually with this project? Do you think you will get good results that you can actually change the behavior of people?
Yeah, I would like to believe that yes, we can change behavior, because I was responsible of creating the behavior intervention, and I try to do my best for doing an evidence and theoretical based intervention. So I base in literature. I work on last experiences in other countries, in other cities. So I really believe that we could change people. But at the same time, I'm aware that there will be limitations that are really complicated to change, like familiar constraints, or even physical constraints for people not living near from their works or from their schools. So I am aware of these limitations, but I think that because of the sense of using evidence and theoretic based approaches, we can actually change behavior, and we can actually help people to change and to adopt new modes of transport.
Yeah, it's I think behavior change in general is really challenging because usually people have been doing the same way before for a very long time, and it's difficult, and you try to change the motivation and habit. What do you see as the most crucial parts for succeeding?
So talking about transport is the most important part of transport is habit, because it's something that we just do. We don't really think about it. We are not going to look outside and say, "Oh, today it's sunny, so maybe I don't need to take my car. I could walk to my work." Sometimes we just take our cars and we are already driving. So what we're trying to help is people to change their habits, to adopt new habits, and it's one of the most important parts. But at the same time, for changing your habit, you already need to be motivated, because changing habits is forceful, and you need you need to be a little bit motivated to start changing your habits. So the most important things are, because we're already working with people that want to change their behavior. So at least they have the intention of changing, but most of them, they don't know how to start changing. So this is one of our requirements for people to participate in our study.
Mm. And what kind of strategies you have for the happy change? How do you approach this problem?
So we are using really classical methods like intention implementation. So the people could create an habitual link between if then. If it's sunny, I take my bike, or if I don't need to chain a lot of travels, I take my bike. So we are trying to create a habit, creating this logical action reaction if then. We also propose the people and ask the people to have clear objective of their change. So they need to say when they are going to change. So if every Monday I will take my bike to go to my work, I will go to my work, my job at 8 a.m. So we are using principally these techniques, and the idea is that people will need to repeat this each week after week, and maybe they can adapt their schedules or their modes, but they will try to do it the same thing week after week, and maybe like that they will try to create a habit. And at the same time, we will help them to try to know how to deal with obstacles. So if it's raining, maybe I will take my bike, but I will take public transport. So, or if I have a meeting really early, I will try something else than taking my car. So we're trying to create concrete objectives, to using intention implementation, and to prevent future obstacles of changing from car to other modes of transport.
Yeah, sounds like a good approach.
This podcast is sponsored by Fibion.
My name is Dr. Paul Batman, and I'd like to just say a few words about Fibion. I've used it a number of times on different projects that I've been involved in, and find that it's incredibly reliable, very valid, and incredibly sturdy. I love the graphics that come with it. It really is very clear and can easily see the active in and active periods as well. So I'd certainly recommend Fibion to anyone that's interested in finding out more about sedentary behaviour, particularly the concept of sitting and how we can possibly break it up with some really good, valid information.
And if I go a little bit back, you said that our participants already have the motivation. So do you only take people who want to change their behavior?
Yeah. So we base for choosing our participants. So we have some requirements for people to participate. We already ask habitual car users, so they need to use their car at least 4 days per week. They need to be between 18 and between at least 18 years old, and they at least need to have the intention of changing. Because when you are targeting mobility behavior change in general change, you don't use the same tools or the same strategies for people that have already developed their intention that for people that don't want at all to change. So for people that already have the intention, the best methods are these ones, like creating concrete objectives, like knowing how to start the action. And for the people that don't really start thinking about it, maybe you need to talk about the health consequences, what they will win if they start taking new modes of transport, or what they are losing if they are taking their car all the time. So we decided to use just people to have only people with intention for targeting the good strategies to help them to change.
Yeah, I see. So how many people you think, how many percentage of people of the region actually have the motivation? Because if you are able to change the people who have the motivation, but there's a very small percentage, it won't change much the situation. So do you have any statistics about how many people would like to change?
Yeah, so our geographers analyzed the data of the last survey on household travel, and we discovered that there were different profiles of car drivers. There were some car drivers that are open to all modes, so they don't especially love driving. They could try other, like 34% of the population here where we live are car drivers open to all modes. There are some other car drivers that will just prefer to have to use individual modes, 27%. There is only 15% of the people that say, no, I just want to use my car. I don't want to use anything else. And so we already we know that at least 70% of the population might try other modes of transport. I would like to try other modes of transport. So I think we can actually have a lot of people trying or wanting to change their travel behavior.
So actually quite high percentage have some sort of motivation to change. I'm actually quite surprised that it's so high. Do you think it's because it's the congestion, traffic jams, or why do so many people want to change?
Yeah, but it's actually a big problem here. There are a lot of traffic jams, so you can be stuck for 30 minutes or 45 minutes here in Grenoble. There are a lot of cars in the center of the city. But at the same time, I think that it could be maybe the environmental part. Some people will say, oh, yes, I know I'm polluting when I'm using my car. Maybe I would like to do something for the planet. And other people that say that maybe they already know that they are being sedentary when they are taking their car. They could move more if they take other mode of transport. So I think there are many reasons for changing their mode of transport. And about that, there is my colleagues and the economists are doing a study about that. If the most important is the public health. So if I change of mode, it's because I'm interested in reducing the pollution that I produce, or if it's more about the price, because it is cheaper to take this more mode or this other mode, or finally if it's mostly about their own health. If I know that I'm winning more years of life or I am improving my health, I would prefer to change of mode. So my colleagues in economy are doing a study about it.
Yeah, so you told about what the economists are doing, but you also have a lot of different fields. Could you tell a little bit about what kind of things the other fields are looking in this project?
Yeah, so like told you before, we work with physicists and with people working in chemistry. So we would like to know if doing this will improve air quality in the region or in the neighborhoods. That's why also we have this air pollution captors, so we can see it in the individual scale. See if for this person is less exposed to air pollution, and if this change in this person of 200 people will change the quality of the air in the city or in their neighborhoods. So that's why they're interested in our study and why we are working together. At the same time, we would like to know if their health in general will improve. So that's why the epidemiologists are working with us, because we would like to know what happens and how. The same for us. What if physical activity is improved during the new transports, and how health in the region will improve if we succeed to change the mobility behavior.
And what do you think if you get good results in the project? Do you see that you could use the same approach in different cities in France? And how easy do you think it would be actually to implement this in different cities?
I think we will, of course, need to adapt it, because what we have here is a flat place where there are a lot of possibilities. Public transport is quite good here, and the same for bicycle lanes. So we will need to be aware of the reality of each city. But at least I think one part of the study could be repeated, could be done somewhere else. And I think it could be a good lesson for government, for politicians, to see that helping people to have an access to transport and helping them using behavior change might actually really change mobility behavior.
Yeah, it is important work that you're doing also from the global and from the globe's perspective. We have now discussed your project related to coronavirus and the physical activity during this, and about sustainable commute. Is there something you would like to add to this topic, or is there other topics you would like to bring into discussion?
I think the thing that I would like to discuss, that working more in interdisciplinary teams will help a lot to better understand the actual problems in the world. And it actually really changed how I think about the mobility. Because if I was just reading in psychology, I would just think that people don't want to change because they don't have enough motivation, or they don't know how to pass from intention to action. But now I actually know that there are other constraints to people, that there are some socio-economical constraints, or even physical or environmental problems that doesn't allow us to change. So I think it's really, really important to start working with other people from other fields, for learning from them and from teaching them also what we do in psychology. And I think it will be really interesting to see more. I know there are other projects like this one in other countries, like in Canada, for example. And I think it's amazing to have these kind of projects because you learn a lot as a researcher or as a PhD student. And at the same time, you have a really big overview of the problem. And I think that's how we really change. We could really change a lot of things in the world.
Yeah, I really agree with that. And I think it's, in general, in research, we are specializing so much that, some people are looking at one molecule within the cell, and they don't really see much other things, like, and this how you approach from all different fields. I think it's really, really good point that you bring up. So I think we're closing our time limit. What would be your final remarks for this very interesting episode?
So I would advise everyone to start using a bike and walking and even taking public transport, because we have seen that it could help a lot to improve our physical activity. At the same time, we are protecting our planet. And in Spanish, we say kill two birds with one stone. And I will say the same thing. At the same time that we are protecting ourselves, we are protecting our planet. So I will advise everyone to start using sustainable mobility and active mobility. It will be nice for ourselves and for the world too.
Yeah, I agree. And in Spanish, you say that two birds with one stone. In Finnish language, we have that you catch two flies with one shot or one strike. So
Okay.
almost same. I'm not sure which is more difficult. But thank you, Claudia. It was a very nice and interesting discussions with you, and it was really interesting to hear about this important and very relevant work you doing. So thank you for taking the time for this podcast.
Thank you very much.
Thanks for joining us this week on Physical Activity Researcher Podcast. If you like the show, make sure you never miss an episode by subscribing or following the show on Twitter. This podcast is made possible by listeners like you. Thank you for your support. If you found value in the show, we would really appreciate a rating on Apple Podcast or whichever app you're using. Or if you would, in a real old school way, simply tell a friend about the show. It would be a great help for us. We have a fantastic lineup of guests for forthcoming episodes, so be sure to tune in. Thank you all for your support and have a great day.
This podcast is sponsored by Fibion. Get scientific validation and learn more about Fibion at fibion.com/research. The Physical Activity Researcher podcast has created an activity tracker purchase guide for researchers. Get your free copy from the link in the podcast description.
Thank you for listening to the Physical Activity Researcher Podcast.